And now we can move to the next speaker. There is a little modification. The speaker will be Giovanni Merone from Roma, take place of Andrea Corbo, and his presentation is Heterologous Collagen Type 1, a new injectable for skin rejuvenation. Please.
Thank you all. Thank you to the chairman. I am Dr. Giovanni Merone. I've been working in Professor Andrea Corbo's clinic named Medical Spa that is based in Rome. It's an excellence clinic to treat problems related with aesthetic medicine, and I'm here to share with you our experience in skin regeneration. We call this new approach tissue regeneration, and is based on heterologous collagen type 1. As you know, as we age, the content of extracellular matrix component decrease. And we found an epidermal hypertrophy and a dermal hypertrophy that is due to collagen production decrease. And this is the main cause of wrinkle onset. In a classical biorejuvenating treatment session, we perform an intradermal injection of several substances that aim to stimulate the fibroblast anabolism. We use commonly hyaluronic acid, polynucleotides, and other substances. But the main limit of this technique is due to fibroblast cellular senescence and the residual capacity of an old fibroblast to produce extracellular matrix components. So we inject in something and pray that our old fibroblast can increase its metabolism. In tissue regeneration, we try to perform something different. Regeneration is a physiological process that leads to a continuous labile tissue reconstruction, and it presumes mitosis. So, in this new approach, we are trying to stimulate fibroblast mitosis and increase fibroblast number in the dermis of our patients. That's why we call this tissue regeneration. This new approach is based on using of a class 3 medical device called Linerase that is based on equine collagen type 1 powder. Equine collagen is known at least for more than 3 decades in medicine for wound healing, for ulcer sealing, and it has documented effect like new fibroblast proliferation, type 3 collagen production, angiogenesis, and other. The classical use of equine collagen is through tablets that are placed generally directly into the wounds and are indicated for as a second-line treatment for difficult wound healing. You can see the tablets placed in the wound. And there is a huge bibliography about this, about collagen, equine collagen activities on fibroblasts. In the study of University of Viterbo, we can see the purity of the product. In this case, the same product was micronized and put into sterile vials for intradermal injection. So a treatment session is performed with a suspension of this powder with saline solution or water for injection. The materials is very close to a typical biorejuvenating treatment session. We use saline solution or water for injection mixed with a bit of anesthetic and a very tiny needle to inject intradermally. So at this point we have performed a clinical study to evaluate patients' compliance and effectiveness on this product in our patient rejuvenation of the skin. So we took this patient group of 321 patients and performed our treatment one every 2 weeks for 4 times. So I'd love to spend here a few words about the mechanism of action of equine collagen, because when we suspend this product with saline or water, collagen undergoes spontaneous hydrolysis, and the results are tripeptides and amino acids. As we know from literature, tripeptides act like growth factors, and amino acids can sustain the de novo synthesis of collagen by mechanism and kinetics. So, when we use equine collagen and suspend the vials, tripeptides stimulates old fibroblast mitosis, and we obtain younger fibroblasts. But tripeptide, in particular proline, hydroxyproline, and glycine tripeptide, can inhibit metalloproteinases. So these 3 mechanisms together can stimulate a huge production of collagen of type 3. So in this new approach, we can gain a more fibroblast number in the dermis of our patient. Tripeptides inhibits matrix metalloproteinases, and collagenous amino acids are used to neocollagenesis. In this study of University of L'Aquila, in a wound healing model, laboratory model, equine collagen stimulates cell cycle of the fibroblast. After 3 days of exposure, cultured fibroblasts switched to an S phase. In this histological proof, our treatment was effective to perform as a real skin tightening effect with no toxic reaction, no allergic reaction, and an increase of the number of fibroblasts in the dermis, more fibroblasts, dermal papillae was higher, and we performed this skin tightening. And now you can ask me why an heterologous molecule like equine collagen can be safe. The mechanism would be 2. First, we inject in our patient's skin tripeptides, molecule very low in molecular weight that cannot elicit an immune response. We have to take molecule of 10 kilodaltons of molecular weight or more to elicit an immune response. And this is why, for 3 decades, no one allergic reaction was reported in using equine collagen of type 1. More than 2 million of vials sold of Linerase, and no one allergic reaction reported. Our clinical result, side effects was very poor and lasting from a few hours to 1 day in a very small percentage, while effectiveness was very high, in particular in improving skin texture. About virtually all our patients could see an improvement of skin texture. The injection technique is slightly different between a classical biorejuvenating treatment session, because we have to pay attention to the distance between the papule we create in the dermis of the patients. we have to space our papules for 2 to 3 centimeters and use a 0.01 ml of amount of the product, or use less amount at less space in the more delicate areas. We can treat in the same treatment session also the neck and the décolleté, and also the back of the hand. So, in a technical comparison, the technique is very similar to a classic biorejuvenating treatment session, but difference are mainly in 2 features. Take care of the distance between our papules and the latency of the effect. The latency is up to 3 days, but our results are very long-lasting, 3 weeks compared with 2 days of classic biorevitalizing product. We perform also another study to better evaluate the good and the ideal amount of collagen to treat our patient. I go quick. We found that the better amount was 100 milligrams because it has really poor side effects and real effectiveness compared with the 2 other amounts. So the compliance curve indicated this, to use 100 milligrams of equine collagen per session. Well, the procedure is made with an attack treatment with 1 session every 2 weeks for 4 times, followed by a maintenance protocol. In the first 4 times, we can see a progressive increase of our effect, of our effectiveness. And after, we can maintain our results performing 1 treatment session every 2 months, or alternatively, repeat the first cycle every 6 months, 2 times per year. This is some photos that showing the strong improvement of skin texture mainly. Treatment is very effective in the back of the hand, for example, where we have poor options to treat our patient's skin. And this is an example of the bioregenerating capacity of this product, because this lady undergoes thread lifting and undergoes this side effect. Professor Andrea Corbo treated these patients with a slightly different treatment protocol, but after only 1 treatment session, we could see that. And after 3 sessions, we saw a restitutio ad integrum. So we also can combine treatment with Linerase with other procedure, for example, carbon dioxide laser, and we can use combined protocols to treat mainly scar tissue, scars or stretch mark, for example. We perform 1 first session with Linerase, followed by a fractional carbon dioxide laser treatment session, and followed by 3 Linerase treatments. This is our results. Postherpetic scar, post-traumatic scar, post-surgical scar, and stretch marks. We can also treat non-pathological gingival retraction with heterologous collagen of type 1. We know non-pathological gingival retraction is like aging, so we can treat with three treatment sessions of Linerase after oral hygiene, performing our treatment at level of the gum, at the papilla. And we can see our results. So we can end the treatment with a restoring mask to raise patient's comfort. And you see immediately after treatment, you can see the papule, but no other side effects. So in our results, we found no complication, no histological damage, a fibroblast gain in the dermis, the collagen increase, and a very good compliance of our patient. We treated with 100 milligrams of collagen powder, suspended in 5 milliliters of saline solution or water for injection, and performing treatment every 2 weeks for 4 times. So this is our results. Thank you.
Thank you very much, Dr. Merone.